Well, Fox 5 Health News, a new virus spread by ticks could be worse than Lyme disease. It's been found in ticks here in the Northeast, including New Jersey, and experts say it is potentially life-threatening.
Joining us now is Dr. Doris Day, Clinical Associate Professor at NYU Medical Center. Thanks for being here, and this is just in time. And it's very frightening because I thought it was only Lyme disease that we needed to worry about. Tell us about this.
Oh no, that same tick that carries Lyme disease carries a whole host of other bacteria and viruses that can make us sick. But about 1 to 2% of those ticks also carry this virus called the Pouassan virus, or POW for short. And this virus, you can get infected after a bite. You can see the signs 1 week to 1 month afterwards. And the symptoms can be much more serious than with Lyme disease. Things like nausea, vomiting, seizures, memory loss, even swelling of the brain that can be deadly. So this is something that you need to pay attention to. If you have those symptoms within a week to a month after a tick bite, see your doctor right away and get the help you need. There's no specific treatment for it, but you can have supportive care to try to get you through and help you.
I mean, that's so scary to me because 1 week to 1 month, who knows if you even knew you got bit a month ago, and then you got to try to deduce backwards that it was a tick bite and it was this, and there's...
So you have to be smart about it. You have to do as much protective as you can. Use tick repellents, wear protective clothing, check for ticks, check your pets for ticks, because they can bring them in the house.
Of course.
I had patients who come in who've never even been really far from their yard, and certainly not in wooded areas, but they send their dogs out into the yard or let their dogs go out and play, and the pets can bring ticks in too. And check your children as well.
I sure do. Okay, let's talk about a new treatment for women with hair loss. It's pretty good, huh?
This is something that's potentially exciting, but I don't think it's arrived yet. So this is not something I do because I don't think that the science is there to back it up in a way that makes it worth spending the money on. This is called PRP, or platelet-rich plasma. You go into the doctor, they take out some blood, spin it down, and then they extract these elements out. And the idea is that you're injecting back stem cells into the scalp that's going to stimulate new hair growth. And this may very well be something that is good in the future. I see it used for everything, from tennis elbow to back pain to headaches to cancer treatments. Like, you know, people use it for a whole bunch of things. But the reality is we need evidence-based medicine. We need placebo-controlled trials with enough patients. We need protocols to know exactly what you need. I have patients coming in, they've spent tens of thousands of dollars and they haven't seen results in a reliable, predictive way. I'm sure some people do get results and some people are really great at it, but right now, in my view, it's still hit or miss, and I think it's something to keep an eye out on, but it's not something to break the bank to go out and try.
Right, because it's not covered by insurance, so you're paying out of pocket.
No, we still have the tried and true. Propecia for men, Rogaine for men and women, or minoxidil. Those are things that are FDA approved. We have solid data on, and even if you do other things, you should be doing those as well because those have the best science behind them.
Right, everyone wants the latest and greatest, but that's a lot of money. All right, very good,
Thank
Dr.
you.
Day. We appreciate that.